I'm going to talk about freehand needling. And for the few Chinese students in here, this is probably no big deal, but us Americans aren't exposed to it very often. So I'm going to try to talk less and demonstrate a little bit more. So basically, there's kind of two different kinds of needling. I shouldn't say two, there's multiple different kinds of needling. There's traditional freehand that we learn in school, or at least we're shown how to do. What I have been taught is called the flying needle technique, and I didn't really even know it was called that until recently. So my knowledge isn't so much, I kind of feel like an adopted child that just learned that I had some disease and I still don't know who my parents are. So I'm still trying to figure out where this is coming from too, but I did find some really good sources. So I don't know about you guys, but for me, it wasn't even an option to do freehand needling in school. It just didn't happen. You just automatically learn from day one, here's a guide tube, this is what you do, and this is acupuncture. Did anyone else have an experience like that?
Nope, we were taught freehand.
You guys were taught freehand?
Yeah.
Yeah, so maybe it was different across the board, and I've seen that for schools for sure, where some people are taught freehand and some people aren't. And for me, I feel like freehand is so important because you can feel the needle a lot better, and that's important for a lot of reasons. I'll go with that. So again, why do we only learn one way? And that's a lot from my experience, but I think that a lot of people are concerned for safety reasons, and guide tubes are easier, and most of our needles come with guide tubes. That's the biggest reason that I speculate. So I called the state representative for Colorado. He's in charge of OCOM and OSHA in the state, so if anything goes wrong, he's the person we call. So I asked him about what the disease transmission was because I couldn't find it anywhere. He said there's really no data on the disease transmission from acupuncture needles that are filiform because the numbers are so minute. So if there is any disease transmission as far as basically infecting yourself, it's really unlikely. Now, when it comes to HIV and it comes to hepatitis, obviously if the practitioner has HIV or hepatitis and they dip the needle in their own blood and then insert it, yeah, we're looking at different statistics. Generally, we don't do that. So, my opinion why we use guide tubes is because we're lazy. That's it. Guide tubes are really cumbersome, actually. So I have a slide here about the tissue, and I liked how Nate went through the different skin layers to Japanese acupuncture. Affects a lot of these top layers because there's a lot of nerve endings up here. The style that I use goes straight through this layer without affecting this layer. It goes right down to the deeper level of the nervous system. Again, I don't know too much about the biology or the anatomy of the whole nervous system, and I'm sure Japanese acupuncture produces a much different sensation than the kind of acupuncture I do. But I get an instant chi without having that prickly feeling go through the skin. So the instant chi feeling that I'm talking about is pretty much exactly what I said, just where no matter how many times a patient has come in to get acupuncture, they're still kind of subconsciously knowing that you're going to stick a needle in them. And even if they say they're not afraid, I mean, for me, I still get a little like, ooh, is this going to hurt? Is it not going to hurt? Is it going to zing? And so I think that's an important thing to address because I think there is a sympathetic reaction in our body about that. And so if you can bypass that without putting the guide tube on and alerting the body right away, then that's a really important thing to do. And I think people really have a better experience with acupuncture. Okay, so freehand needling and flying needle. I'll go through both of them, but there is a difference. Freehand needling can be slower sometimes. You use different fingers. The thrust is a little bit different, and the chi can definitely be different too. So what I like to do with my example here is the worst technique for anybody who does any body work is if you press with your thumbs and your fingers. That's not a lot of good technique when you're using a massage. You're not going to get a deep massage. It's not going to feel good. But if you lean your whole body in, you get a lot more press there. And it's the same thing with acupuncture. If you kind of just use two fingers when you're needling like this with freehand, it's not as nearly as effective if you're going like this. And it's not that exaggerated, but This is straight out of one of my acupuncture books that we had in class. And you don't have to read this, but I just want to go over the fact that when they say they do practice, they say about freehand, when you practice freehand, you want to go like this. And that's my response. Don't ever do that. That will hurt so bad. So flying needle technique, this is all I really know. Again, I feel like an adopted child. So a little history, I worked at a great acupuncture center in Denver for several years. I had a great opportunity to work as an intern when I was in school. And my American mentor was mentored by a Chinese man in California. And the Chinese man was the one who taught her how to do this flying needle technique and then passed it on to me. She really didn't even kind of know. She was in the same boat. She didn't even really know how it came about either. And so I'm still learning myself all about it. So it came from this Dr. Chen, who's been practicing, I believe, for 60 years now. I do have an article on Dr. Chen that I did upload to the site too, if you guys want to read it. But he basically, this Dr. Chen wanted to invent a needling style that was safe, pain-free, and easy to administer from the acupuncturist. And flying needle accomplished all of that. So the one thing that I found about Dr. Chen and the flying needle technique, since it's relatively new, is this scholarly article, and there's not a lot of meat in it, but it does explain a little bit about how Chen is trying to standardize acupuncture needling into the flying needle technique. So it did cost me a significant amount of money, and I gave it to you guys to read. It's kind of interesting. So directly from this article, paraphrased, it basically is named after the motion exerted on the release of the needle, and the handle of the needle is held while rotated slightly. So you can either rotate it to tonify or sedate while you're needling it, and the release is like a flying of a bird, so it's kind of like this. In other words, and you can certainly do this because I'm going to have you guys practice, it's really fun. So your index finger is the one used as a guide. So your index finger is not the one that's used to actually insert the needle. Your middle finger is kind of the key. It's rubbed together with your thumb as a flicking motion, like this, like you're flicking water. So you're going to place your thumb on the medial side of your middle finger, and then your ring and pinky fingers will be up. These two fingers will be up. And again, this finger will be used to guide the needle. I always use my pinky to kind of balance my hand when I'm kind of going over the point, and then I flick it in. You can also slightly bend the needle too. That's another technique that's really useful to actually get the needle in the direction and the depth that you need. I often use longer needles to make sure I'm not contaminating the needle, just in case there's any issue with that. Most important thing is be fast, forceful, and not hesitate, because when you get scared is when it can really ache. So that's a little picture of how I do it. This is a learning experience for me too, because I'm not really sure how I even do it sometimes. It improves your results, patient compliance, and trust. A lot of times I've got people who come in who are deathly afraid of needles, and now they're regular patients. So it's faster, it's virtually pain-free, you get immediate dead chi sensation. I used to do a ton of electroacupuncture all the time, and now it's I get such a good dead chi sensation, so I don't do a whole lot anymore. Ability to do more points with patients because you're already getting that chi sensation. It's way more accurate, which kind of seems weird because guide tubes are meant to make it more accurate. Angle and depth is achieved with one thrust. You're not sitting there, cranking on the needle. Minimal stimulation. Practitioner gets better tissue sensation, so just like sticking a fork through mashed potatoes versus like a gummy bear, you can feel the needle a lot better. Versus a guide tube, you're kind of like hitting on the needle, and you can't always feel what you're needling through. And it feels unbelievably amazing. So here's some non-flying needle techniques that also work quite well. So pinching, I like to do that a lot. And then this is called stabbing, which is really awful.